Imagine a future where type 1 diabetes can be cured, not just managed, and we can stop dancing around the word cured like it's a bad word. Now, for millions of people with diabetes today, that means relying on insulin injections. In this video, we're going to explore some of the newest research coming out on stem cell transplantation and the fact that it's gotten a 25-year-old woman with type 1 diabetes insulin independent for over a year. So what exactly is type 1 diabetes? Currently, it's labeled an autoimmune disease where the body mistakenly attacks and destroys insulin-producing beta cells in the pancreas. This could have something to do with the immune system misidentifying things in the beta cells. It could also have to do with the inner workings of the beta cells and their functionality. For those living with type 1 diabetes, management involves frequent blood sugar checks and insulin injections. But these treatments only manage the symptoms. They are never meant to cure the disease. And this is where stem cell research comes in, offering a potentially long-term solution in restoring the body's natural ability to create beta cells and create insulin. Stem cells are like blank slates. They can become anything they want to in the body. In the early stages of stem cell research, stem cells were harvested from newly formed embryos. But over the past 20 years, doctors and researchers have established a way to take our own cells, which have specialized into particular cell types, and reprogram them to be stem cells again. So in the case of type 1 diabetes, these doctors have taken these reprogrammed stem cells and programmed them again to become insulin-producing beta cells. The hope is that these transplanted beta cells can reestablish themselves in the previously damaged tissue of the pancreas and take hold, sense the glucose, start creating insulin again, and naturally regulate blood sugar levels. Now, this past September 2024, a new case came out of China where a 25-year-old woman treated with these reprogrammed beta cells had her diabetes completely reversed after a stem cell transplant. She received insulin-producing cells derived from stem cells, and 2.5 months after the transplant, she became completely insulin independent. The new stem cells were injected into the muscles of her abdominal wall, which is a new technique. Previously, most of the stem cell transplants were injected into the liver, where they couldn't actively be traced and monitored. However, in the muscle wall of her abdomen, they could be. And another common feature of stem cell therapy is the need for immunosuppressants. And this is to prevent the body's natural immunity from rejecting these new foreign cells after being injected. Now, while this study did not actively give this 25-year-old immunosuppressants, she was using immunosuppressants from a previous surgery. So this is a little bit of a gray area. Ideally, the stem cells would be able to be injected without the need for immunosuppressants. Again, as someone with type 1 diabetes, I'm looking to get off of dependence on foreign pharmaceuticals, foreign medications. Now, she was using this for a liver transplant that she needed previously. The doctors themselves did not elaborate on whether or not the immunosuppressants that she was using had an effect on the survival of the injected stem cells. But the doctors acknowledged that there is a lot of work going into stem cells that are able to evade the immune system. So why is this breakthrough so important? For those with type 1 diabetes, it offers a new outlook on the scalability and accessibility for stem cell treatments. The article stated that the procedure of injecting the stem cells took about half an hour, and within 2.5 months, she was off of insulin entirely. So this is something that is easy to get excited about because no more finger pricks, no more insulin injections, no more runs to the pharmacy. This is you go in for essentially an outpatient procedure with your reprogrammed stem cells, and 3 months later, you're not having to do any of the normal diabetes management things anymore. And because these stem cells are derived from the host, from each of the person needing them, and essentially in unlimited qualities, this gets rid of the donor list shortage, the fact that we couldn't get enough embryonic stem cells or we couldn't get enough donors in order to supply the millions and millions of people with diabetes. And while it is incredibly exciting to hear about someone with type 1 diabetes not needing insulin anymore, it's important not to get carried away with just the good. There are a lot of details in this paper that need to be looked at again. The first factor is the need or the use of immunosuppressants. What we want to work towards is a time where stem cells can be injected and we have no worry of the immune system acting on those transplanted beta cells. Because it's been found that long-term use of immunosuppressants can lead to potential risks and side effects down the road. And it leads to the second point, without addressing the actual root cause of the immune system activation on the existing beta cells, we can't promise the longevity of the injected beta cells. So without addressing the immune system acting, we are essentially signing up for maybe a recurring injection of the stem cells. So let's say you have your stem cells injected, you are insulin independent for a year, but then those beta cells continue to get acted on and slowly fade away until you need a new injection. And this leads to the third point, in which the paper largely ignores the complexity of autoimmunity. The fact that just having new beta cells is only half of the issue. We don't just need new beta cells, we need a body and an immune system that allows for those beta cells to flourish. So unless we find out what was the original cause behind the beta cells being destructed and taking the insulin away, we're just kind of taking 2 steps forward, 1 step or 2 steps back. And the doctors and researchers involved in this study were largely avoidant when it came to acknowledging the systemic nature of the development of diabetes. The particular case study, the 25-year-old woman, had needed a liver transplant previously. Now, 25 is a little bit young for someone to have a liver transplant, and they didn't acknowledge what the role of that liver dysfunction was on her having diabetes. This could be a downstream complication, so maybe she had untreated diabetes, which led to liver failure, or it could be she had liver failure and that liver dysfunction led to type 1 diabetes downstream. But no matter how you look at it, this advancement in stem cell therapy marks a significant breakthrough in the treatment of type 1 diabetes. We're turning stem cells derived from the host themselves into an outpatient procedure where they can be injected. And within 3 months, you are insulin independent. And for the following year, you remain insulin independent. That's something to be excited about. But don't let this convenience and accessibility breakthrough keep you from seeing that we still need a comprehensive approach to allowing these beta cells to flourish. We need to remain focused on the pathogenic, the nutrient and malnutrition aspect of the development of diabetes, so that when we have these new beta cells growing in us, we are in a position to keep them there. And that's all for our breakdown on the most recent article noting the breakthroughs in stem cell therapy for the treatment of type 1 diabetes. I can't thank you enough for being here. Make sure you subscribe to the channel. Check out the description, all of the links for ways that you can support the channel. Thank you and have a great day.